What's up, beautiful people? Another day, another study. I saw this study first circulating around in certain circles where people tend to outright ignore a lot of the data surrounding LDL-C and cardiovascular disease risk. But this study was done in patients who were asthmatic. They looked at people who had asthma, people who didn't have asthma, and they looked at lipid markers and found that for every unit increase in LDL-C in millimoles per liter, that's a different metric that we use here in the US, they found a 17% decreased risk of death. Now, there are some major caveats with this particular study. The first is that there was only 189 deaths during the trial period. That's not a lot of events, and that makes it really hard to detect a signal between the two groups when you don't have a lot of events. Another issue is that they didn't actually confirm through diagnostic testing, like pulmonary function testing, if the patients actually had asthma or not. The people who were in the asthma group, all they had to do was say, have you ever been diagnosed with asthma by a physician? I know, being a physician, that a lot of people have been misdiagnosed as having asthma or told they had asthma and never received asthma treatment, never received a proper diagnostic technique or anything. And then they didn't measure lipid-lowering therapy in the follow-up. So it could be that people who had the lower LDL-C got on lipid-lowering therapy and had other causes for increased mortality. So I would take this with a grain of salt. I wouldn't draw any hard conclusions from this study. I think this area is interesting where we look at personalized medicine, because we're seeing that, okay, is there a difference in certain markers between different groups of people, and what prognostic value do these markers have, instead of treating everything the same for everybody. So I think there is some benefit in that approach, just not anything that I would draw from this particular study.